So how have you been? It's been,
I've been well and busy.
yeah,
All good.
yeah, same thing here. Like we just have another workshop and next to another one and then something else and it just always but it got we're in a real summertime now here, so it's it's tough during the day. It's hot, like it's really hot. So it's all training, everything we do, it's kind of inside mostly or very early in the morning, and then it's like, okay, let's, yeah. Have you been back to California?
I was out, I think, twice since you
Okay.
did training out there,
Okay.
and we're headed to Mexico on Saturday. So
Mm,
we're
mm.
taking a week, and a bunch of her friends and my children are joining us as well. So it's going to be
Awesome.
a fun time.
What part?
Puerto Vallarta,
Okay.
Pacific Coast.
Yeah, 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 yeah. That's cool. Yeah, I mean, I know of it, of course, but I have not been on that site.
Me
That should
either.
be. That
My
should. Well,
first time.
I think that it. I like it. I think they. I like traveling anyway, so I think you guys do. So it's gonna be cool.
It'll be great. I thought this was like drunk Shakespeare, so I've been preparing.
Perfect. Perfect. Whew, so we had this cool conversation the one time at the dinner when we were together and when I met you, and that's kind of how the idea of the podcast came about, and for me, not just for the people that listen to the podcast, but for me as well. Give me a little bit of background. Tell me what you do, how you got into it, and a little bit of a background.
I'm a practicing veterinarian, and I graduated in 1990, so I've been at this for 34 years. And prior to vet school, I worked for a small animal dog and cat veterinarian for a number of years as a kid. And so I've been around dogs and trained and untrained dogs, dogs who are challenging or awkward in the clinic, and dogs who are super easy to work with for just about 40 years. And so I have a strong interest in training, behavior. I have a strong interest in how owners impact and affect the behavior of their dog during stressful encounters. And of course, in the veterinary environment, where we're asked to do or expected to do, or we need to do certain maneuvers that are unpleasant. Something that sounds as simple as a nail trim is, in fact, a fairly unpleasant, painful procedure because of the anatomy of the dog's toenail. The anatomy is such that even when you're cutting in the right place with the right equipment, it hurts. It's an unpleasant task. And so you can imagine that dogs think you're trying to amputate the toe, or they think you're trying to, deliberately harm them. And so for the most part, we're dealing with fear, reactivity. We're dealing with dogs who have not been conditioned in any way by an owner to accept these kinds of things, which are scary. And so I know that no dog, or very few dogs that I see in a week, very few dogs wake up with an intent to harm a veterinary staff member. Very few, thankfully.
Right, right,
Many of
right.
them react and act and look just like they were practicing to harm you. It looks very intimidating, and it's very frightening for staffers as well. And so my background is just as a clinician trying to learn how to work with these dogs in the safest possible way. And the best terminology that's out there right now is low stress handling. And before it was a coined or it's not catchphrased yet, or it's not trademarked yet, but that's the term that many people use. Before it was that uh, uh, that crystalline a term. We deliberately avoided overstressing dogs whenever we could. We didn't always reach for a muzzle every time a dog came in the door. We let them interact with us. We let them approach us. We tried to avoid excessive restraint, excessive
Right.
pressure on the dog. Allow the dog to interact with you and perhaps calm down a bit. What I find particularly helpful is to engage the owner for a couple of minutes before we even touch the dog, is just talk to the owner, find out what they're doing, and calm them down a little bit, because the dog is looking around the room The owner's anxious because they know they've got an awkward dog. The dog does the math, goes, Mom, new guy's the problem.
Right.
And so if we can calm the owner down, sometimes these dogs are much, much better with a calmer owner.
Yeah, I mean, definitely. And on top, when you add whatever the actual issue is that the dog is coming for, and the anxiety of the owner, just the concern and the worry that, well, is my dog gonna be okay? Is he gonna stay here? Are we gonna do surgery? All that on top of, I mean, like, it seems like doubling, tripling down on bad vibes at the
Well,
same
and
time at the worst case scenario, right?
sure. And of course, we know that dogs literally smell fear. They literally smell disease. They
Yeah.
literally smell an amazing array of compounds. And when you're anxious, when you're upset, when you're angry, when you're sad, your dog can pick up on that quite easily. And it's not mysterious, it's chemistry. And so when the owner comes in fully expecting their dog to behave badly, in some cases it's a self-fulfilling prophecy. Now, we also have that compounded by owners who are doing the wrong things and they're trying to correct fear behaviors, and that doesn't typically go
Right.
very well. When you're trying to overly restrain a dog who's already fearful, generally that dog becomes, escalates its reactivity. So it's a big challenge. And for me, it's trying to strike a balance between simply separating the dog from the owner, which is often not good. Often the dog is better if we can get the owner a little calmer. Uh, and I think it's also useful for an owner to see in which sort of maneuvers the dog is awkward. I think it's enlightening for them to realize that, well, we just brought him in for a nail trim. Well, you say that as though it's pretty easy to do. And when your dog's 110 pounds and is trying to, flail, there's not a lot you can do physically with a
And
dog
and
like that.
that, there is a reason why he's coming to the vet that they're not doing it themselves, right?
And we every month we have somebody come in. Usually it's a new client because they don't know how difficult their dog is, and they say, "Well, we just wanted the nails trimmed," and we'll typically do this kind of stuff in the room so they can experience what it takes to do it. And we have a rule that if it's going to take more than a muzzle and one set of hands plus the owner, we probably need more chemistry. We probably need to do something different for safety's sake for that dog.
What do you think? And I know that probably is going to be not an easy question to answer, but just if you're to take a guess around across the country, how much do you think the percentage of veterinarians that are also understanding and are tactful and are making an effort to make that experience as pleasant as possible, even though a lot of times it just cannot be. But I go to, I mean, I lived in different states. I was in California, I've been around, I was in Kentucky, I was now in Florida, and I go to different veterinarians. But of course I have the experience, I have some relationship. And even then it's very difficult. It's almost like kind of like I don't want to put it in the same category because you guys going through insane amount of education for what you have to do. But in amongst dog trainers, you have dog trainers that are dog trainers, and then there is a different level of dog trainers that may do a little less, but they know what they're doing and they accomplish more. And I guess the question again is, with the overall picture, would it be even possible to say where the veterinary practices are at the moment as far as being, how do they deal with the problems we're discussing already?
Well, because there's been a lot of interest in particularly a branded and trademarked program called Fearfree, and so that has gotten a lot of attention, and people sign themselves and their staff members up to go through this certification process to learn what are essentially low stress handling techniques, and it's a packaged, promoted profitable enterprise. And if it's a way for a vet team to become better and more effective at handling these dogs and cats for that matter, then great. But I bristle a little bit because there is a profit, baked into this thing, and there were a lot of people in the field of veterinary behavior who were advocating for low stress handling techniques before this became a trademarked, sold kind of cookie cutter certification. I also secondarily chafe at certification where, it's a one and done kind of thing. And there's really nobody watching how you do this stuff. There's nobody really, having a second opinion on are you really applying what you became certified to do.
Right.
And so I'm sure, encounter that with dog training where people get some sort of credential and they're in fact terrible, but they somehow got a credential. And because of that, they now look less terrible to some people. And so I chafe at certifications that really don't come with any sort of quality assurance to follow them. But it's hard to know. I think veterinarians have to have an interest in just being more humane, being more effective with their patients to really get interested in a low stress approach and not automatically assume a dog, even though it behaved poorly the last time. Sometimes they get better. In fact, I had a dog in today. It came in as a quite young dog. It was under 6 months, and literally we could not touch this dog for its first exam. This dog was like a Moulinex, flying around, trying to bite, just about,
I'm
chewing
smiling,
on the tool.
but I'm not smiling. I know how
You know what these dogs are
when you
like.
yeah when you I mean it's funny when we're having a talk conversation outside the work, but when you have to get to examine the dog and you have this kind of dog, it's just not pleasant for anybody,
So,
including the dog.
oh, and yeah, and the owner's horrified. The owner has no idea because they've had this dog for a few weeks at home, and the dog seems to be, ticking all the boxes of cute, small, short-coated terrier mix. The dog was in earlier today, and to do anything noxious, we routinely muzzle her because she is reactive. But today she was absolutely fine. She made no evasive maneuvers. When I took the muzzle off at the end of the vaccination, she came up to me, greeted me, took treats from me, was actually looking kind of friendly. Now, I don't think I'd try to vaccinate her without the muzzle just because that's a terrible mistake. If you think it's going to be safe and you decide not to use a very, very benign tool like a muzzle and you're wrong, that's a very big error. The dog loses, whoever gets bitten loses. And then everybody's quite upset, including the owner. The owner,
Yes.
justifiably gets horrified from that. So, but the dog has made a quite amazing transformation. And the owner does not do any deliberate training, but we've been very careful to, be safe with the dog, not allow it to actually harm anybody, and not to just brutally restrain it when it comes in. We don't just, throw it to the floor with a muzzle and do what we have to. We
Right.
bring it in on some sedatives so it's having a better experience. And because the dog has now had a few visits where nothing really terrible happened, the dog is kind of warming up to us as well.
Yeah, I think one of the keys, and that probably is also very problematic because, like, you cannot sometimes, you have a busy clinic and you know that you need to take some time with each dog, but then at the same time, you have to keep things moving. And so that must be difficult as well for having a busy clinic sometimes, right?
And it's, there's a certain amount of we just have to get to an end point. If it's a sick patient in particular and it needs blood drawn, it has to be done in a fairly expeditious way. We can't have them come back for 3 weeks in a row to do happy visits, just come
Right.
in, get a dog treat, step on the scale, leave by the back door without anything happening. Though we still encourage, we have a handful of dogs over the years where they've been so challenging that we do have them do that. And we've got a dog right now, happens to be a Malinois, and the dog is an incredibly reactive, incredibly strong dog who does not have a job. this is a dog who's a pet who really should be in a working dog environment. This dog should really have something to do 6 to 8 hours a day with a professional handler driving it. Instead, the dog's expected to be, this fantastic looking, beautiful, and it is. It's a perfectly healthy, beautiful dog, but the dog is just, a 10 out of 10 for reactivity.
Mm.
This dog came in and did happy visits with my office manager for many months while it was a youngster, and my office manager could hand it treats and so forth. But this dog, without lots of meds on board, without a cage muzzle already installed when it comes in the building, this dog is dangerous. This dog will definitely try to bite people because it's so stressed. And again, it doesn't have any sort of diversion. It's not out there doing stuff as it was designed to do.
Right. Yeah, and I mean, fortunately, we have the option, or you have the option to tone it down. What is typically medication that like your go-to in cases like this? What would you guys do?
So our goal is to make them slow enough that they can be safely handled in the whatever we need to do.
Yeah.
And sometimes what we need to do is have them slow enough that they can be safely muzzled, so we can give them intramuscular sedation to do things. We have a handful of dogs that need intramuscular full. They have to be knocked down, just about full anesthesia to touch their feet, and that's not a large number of dogs, but it's a number of dogs. And they need sedatives even to get that intramuscular injection on board safely. And so our goal is to have them come in, have whatever we need to do happen safely, and then have them recover fully and go out the door without feeling like they've been just brutally wrestled into place. I was at a conference probably 25 years ago, and it was a pain management and sedation topic, and the presenter said, well, how many of you people are still just, if the dog's being bad, you just call in more technicians
Right.
for additional restraint?
Jump
And he
in.
said, how many of you have nail trims where it takes 3 technicians plus a muzzle to do it? And a number of people, including myself, raised hands. He says, if you took your child to a pediatrician's office and they were so frightened they shat on the table, wouldn't you think some sort of sedative might be better? A better approach could be done with chemistry. And so it was a neat way of phrasing it, that it's, again, these are fearful encounters, and yeah, you can physically restrain them, but that doesn't really address the underlying absolute fear that they're coming in the door with. And if you give them sedatives, I think there is quite a bit less fear. They're not nearly as reactive. They can't quite escalate as much if you can give them sedation. And then which sedative you use depends on lots of other things, which have to do with the medical history of the dog and
Sure.
and what seems to work in your practice and so forth. But they're all more or less sedative tranquilizers, sometimes with a little bit of anti-anxiety baked into them as well.
You're in Pennsylvania, right?
I am.
Yeah, because I don't think we mentioned this. How was it COVID times? How did it work for you? How did you work around it?
So we were incredibly lucky because I'm a solo practice, and I've got 3 exam rooms. I've got a divided waiting room, and our schedule is pretty clear, and we don't tend to stack people up in the waiting room to begin with. And so we had a meeting, all of the staff at my practice. We had a discussion because everybody was going what they called curbside.
Right.
Owners would stay in the car.
Yes.
The dog would be extricated, separated from the owner, taken into the building. Whatever happened, happened. And then all of the communication were either text or phone call or email afterwards. But there was no physical face-to-face with a dog standing next to an owner. And I can tell you that most dogs, even if they're awkward, most dogs don't do that much worse, and many of them do better in the presence of an owner, particularly if we allow the owner to calm down a little bit. And if the owner realizes that we're not mad at the dog, and I never get mad at the dog because I realize the dog didn't wake up, wanting to be awkward. even though I might get frustrated, I make sure that I clarify with the owner I'm not frustrated at the dog. I'm frustrated that, we now have to
Just
change direction or regroup
yeah,
or whatever.
yeah, yeah,
And make sure the owner isn't thinking that we're upset at them or the dog. It's just what it is. It's awkward, and we have to professionally work around that. So our practice never had to go curbside. So we were lucky that we didn't really have to change very much about what we did. We made sure that we never had two clients in the hallway or two clients in the waiting room. And so we sometimes asked them to wait in the car until we had a room available. And we didn't have to really change
no,
all
that's
that much. And we
perfect.
didn't lose the communication that many other practices were forced to lose, because if you're a multi-doctor practice, you could not do it the way we did it. You would invariably have people stacking up in the waiting room, and that was a no-no. There was just no way that they could do it. And so I get why people had to do it. We were just fortunate that we were not forced to do it.
Yeah, that's for sure. I know even like clinics that kept that way of curbside even a little after the whole COVID thing was already done. Somehow, I guess either they were extra cautious or it was working out for them, which I really
Candidly, some veterinarians and some vet techs prefer not to have the face to face with the owner. They're
right.
all about the dog or the cat, but some of them find the communication with the owner to be a little bit vexing. And there are clients where I find it also vexing, but the information that I glean from a careful history directly from the owner is very important. And losing that or trying to substitute it with all of the indirect, not face-to-face methods, there's always stuff lost. No matter how careful you are, no matter how thorough you try to be, there's always a reduction in quality of information when it's not face-to-face.
Yeah. Let's go back to the fear free because it's of course it's gaining popularity. And as I'm saying, it's gaining popularity. There is, I like people definitely are talking about it, and people that own dogs. It's like, oh, okay, this clinic is fear free and this one is not. So which one do you go to, right? I've been twice. No, I've been 3 times. Besides my regular veterinarians that I have very long relationship with, and I don't even know if I should ask them to find out, because I haven't really even paid attention if they've subscribed to that or no. But the few places that I went, from being a dog trainer, I did not understand what the actual fear-free effort, like what did we do when we met, when we examined the dogs, like where was the difference besides the one veterinarian, and actually I don't think it was even the doctor, it was the technician, came with a big bag of treats and almost gave half a bag, just like handful after handful to my dog, that I eventually had to say he not gonna bite you anyway, he's okay, like we're gonna make him sick if he just eats this whole bag of just, regardless of what they are. But that's kind of my experience with it. So I'm curious how familiar you are. You said that and that came as a surprise a little bit to me, that there is actual certification in a process, and it's almost like some kind of an enterprise, like it's a
Yeah,
business,
it
like.
rolled out. It rolled out some years ago, and then it was promoted by an association that I'm very fond of. The American Animal Hospital Association was part of the promotion of this fear-free certification, and none of it is a terrible idea. It's
Right.
not bad to become better at dog handling or patient handling in your practice. But what really bothered me was that it was promoted as a wedge certification where they would somehow take out advertisements, or they would somehow get the media's attention, and they would say, well, if you don't go to a fear-free veterinarian, your pet could be having a worse experience. And again, there's a lot of us who've been trying to learn how to handle dogs better for a very long time as just part of our practice. And we recognize that what we're doing is scary. We recognize that what we're doing is noxious, and we're doing our level best to get better at it and less scary to these dogs. And to have somebody come out and more or less self-promote their their certification program, their school, from which they directly profit and their family members profit because they're part of this business enterprise, and then to go advertise against people who are actually doing a pretty darn good job, and perhaps they had to learn as they they had to learn the hard way. But there are other resources apart from Fearfree. There are other low stress handling programs. In fact, there's a competing certification program as well for low stress handling based on some other behaviorists' work. But you can get pieces of this, and of course, if you've been in practice for any length of time, you can figure out pretty quickly what works and what doesn't in terms of making dogs more or less calm during these noxious procedures, and then letting owners know what they can do to help with these kinds of things. And sometimes the best that they can do is teach the dog how to wear a cage muzzle and come in prepared so that we can do things safely and take it from there.
Yeah, this is interesting. By the way, I like low stress or better than fear-free, because anybody going to a vet clinic or a person going to a hospital, when there is something wrong with you, you're anxious, you're a little bit scared of what's going on, like, and fear-free is it's a like, I cannot help myself but make that parallel analogy with the and they do come together, the force-free dog training and the fear-free vet clinic environment, to where sometimes in training, force-free clearly is not successful, and there is other options that are successful. And then what do we do? Where do we go from there? And yeah, it's an interesting one, because it kind of, you really go, I think they go hand in hand, and they're excellent ideas. But again, how much, when we say it's fear-free, like what are we really saying? Is it just a catchphrase? And yes, we have good intentions and we understand, but as you were saying, a lot actually, like you were saying, at least teach the dog how to do a muzzle, but I just had with my school that we have and we are constantly having different cases of behavioral problems and so on, and discussing as a group. And just a few days ago, we had one that it's actually a graduate from the school with their own dog that's now 7 months old. He goes to the vet and he decides to buy the technician. And then I think the dog sitter comes and decided to buy the dog sitter. So it's in like a age thing, and it's just something going on. But anyway, we had to talk about what can you do as an owner to help your dog and yourself when you go to a vet clinic. And when we started to break it down, there's actually a ton of cool things that you can do, including teaching the dog how to be patient, how to just, if it's sitting or standing, but just to be still for a moment. That's already a big deal. It's like, hey, and And this is training. This is a very easy training. And most dog trainers, regardless of what style and school they come from, they can teach a dog in a very friendly way to just hold on just for a few seconds. And then we can build from there. Let me lift your lip. Let me pull your eye. Let me flash you with the iPhone. Let me poke your ear. Like all these things that are, when they happen for the first time inside the vet clinic on the metal table, the dog is like, what the hell is going on, right?
Right.
And all that as a game, like literally as some cool game can be done at home. And to me, this is, if we're gonna talk about low stress or fear-free or, just helping your dog, there is a little bit of education that is missing that, and I don't know if it's missing actually. Maybe it's been like, that's kind of what I was saying. What is the protocols of the fear-free? Does it start in the clinic, or because to me, everything starts at home, and silly things like this, and even okay, so lay down and roll over on a side. Just hold on. Let me touch your feet. Okay, get up, get a treat, or let's play ball for a moment. Taking the time in the same way as you would take the time to teach your dog to walk nicely on leash when you take him out. You really, as an owner, if you have some guidance, and this is the question that I'm not sure if there is such protocols, but most owners, if they have some guidance how to, they probably can help their dogs, help you to do your job, and basically the whole experience going to the clinic can be all around improved by 10 times at least. What do you think?
Well, I think, pardon me, I do think the owner plays a huge role in shaping behaviors and improving reactivity to certain things. Many of those things could be conditioned at home, but I think your world of dog training has elevated you out of the masses. And so the average pet owner is who I see.
Mm-hmm.
And the average pet owner is in love with the idea of a well-trained dog, but is not willing to put in the time or the effort, or doesn't have the right training mentor to guide them. There's a very popular local trainer in this area who will put a prong collar on a dachshund, a mini dachshund, as just every dog gets a prong collar, and they have a very, very 1960s police dog training style where everything is all correction. You've got to show it who's boss, that kind of thing. And there's no sort of play. There's no sort of expectation that if you're working with young dogs who have a baked-in play drive and a need to play and a need to have manic play, that you've got to let these dogs burn it off before you can really start shaping that behavior. You can't shut down play in a very young dog. You've got to work with it, and that means when they're ready to train, you've got to be available to start working with what they're letting you teach them.
Yeah.
But when they just want to play and go nuts, you've got to kind of shape that and direct that and let it happen. And so I think the casual, typical dog owner is just not engaged in the process, and I don't know how to engage them. I try to. We try to encourage. We have a humane trainer who uses mostly positive techniques. She's not overly heavy with corrections, but she does correct. She does, understand that there needs to be at times a humane correction of certain behaviors. And so we like her. We like that she's a good communicator with clients. But very few clients, unless their dog is a problem, very few clients take us up on that suggestion. What drives people to seek a trainer is a dog bite. That's when people start getting serious about training their dog, is after it's bitten somebody. And so we have a subset of dog owners whose dogs are reactive and challenging, particularly dog-directed aggression, and then people are bitten while they're trying to break up dog fights. That's the biggest one that we see in this area. Though we have some human-directed aggression dogs as well, but until they bite somebody they care about, they don't typically take dog training very seriously.
Yeah, interesting. Yeah, you're right. You're right. That's uh, um, I do think from a high-end dog trainer point of view. I guess you're very correct. They have like, would you what does it take to say I cannot accept that dog in the clinic? Like, have you had times where it was like, okay, this is just a really dangerous situation, and or you would rely to the meds at that point and you take
It
care of it?
has it has been a very long. In fact, I can't recall the last time that we thought a dog was so dangerous that we couldn't deal with it. But I had probably 5 or 6 years ago. I had he was from another jurisdiction. He was a police dog handler in another jurisdiction. Came into my local community and became a peace officer within the community, not as a dog trainer or dog handler, but just as a regular beat cop. And he happened to have his own, personal dog, now 2 years old, totally untrained, highly reactive German Shepherd, and the dog was just dangerous. The dog was, big, was in the, absolutely as healthy as could be, had no manners, no training, and was lunging, trying to bite me as I stepped into the room. And so this particular guy is trying to, brutally correct the dog with a prong collar repeatedly. And I said, no, we're gonna send you home with medications. We'll come back. We'll try to do this a different way. And I had to walk past the dog in the hallway to get to my office, and the dog bit my sleeve. Luckily, it didn't get my arm, but it got my sleeve. And the dog just about strangled the owner. Just about strangled his own dog in the
Right.
hallway. And I said, "Stop doing that, please. Stop doing that. Just leave." And he left, and we fired him because he was just the wrong owner for that particular dog. And we said, "We just cannot see you if this is the way you're going to treat this dog." And he was indignant because he had 35 years experience, as a quote unquote police dog handler,
Right.
but it was
Right.
the barbaric techniques that they used to use. And I guess that made some dogs good apprehension dogs, but I suspect it just made a lot of police officers, repeatedly bitten by a dog that was, psychotic. The dog didn't know what to do. It was sort of
Yeah.
getting corrected for reasons it could not understand.
Yeah, I would agree with you. It's actually as unfortunate as it is. I think it's still very pronounced. This happens. It's just lack of training. It's a different how the police departments who teaches where they have to learn from, how much time they have, then how much they really want to be a dog trainer, because when you're in a canine unit, you have it as a job, but at the same time, unless you accept the fact that you are also becoming a dog trainer and you learn how to train dogs, you will end up with similar situations, which is unfortunate.
Well, the notion that you can train a dog and just hand the leash and that dog to somebody else and have it all work that's just insanity to me. That somehow a dog can be prepared to do a complex job. These dogs are not being asked to simply, go forward and sit like a detection dog. Perhaps they're being asked to do incredible things, and you're expecting the dog to make a lot of independent decisions about danger and react to threats. And to think that you can somehow train that dog and just hand it over to somebody else as the handler without having them deeply engaged, with a training interest, that just seems like it's doomed.
Right. Every once in a while, you see some very like nice, like very very knowledgeable people amongst the canine units, and yeah, it's a difficult. And also, it's probably like every job, um, there are levels and there is different. What about the spay and neuter? How do you feel about those? Um, I'm telling you this from going back to. So I worked in the early 90s at Guide Dogs in San Rafael in California. And then I worked in the San Francisco SPCA. And at both places, and we had a very good understanding why we're doing this. There was an actual real good reason why, but everybody got spayed and neutered, and we were doing so many to where us, the trainers, would also assist the doctor to do it. Like I felt like I could actually do it at some point myself. Of just doing so many at the time, you know. But from not even having the education that you do, I know that there is an incredible amount of hormonal change that affects. And my belief is that if we are doing something good, that also has some other effects on the body and the mind and everything else. So how do you feel? What do you think of spay neuter today?
So the evidence remains a bit unsettled because most of the studies that have been cited were not actually well structured. They were not designed to answer the question they're attempting to answer. And I don't know that we're ever going to get those studies because it would likely have to be done breed by breed by breed, and it would have to be well controlled, well set up to find out what is the optimum age from a health and behavior standpoint. And that might be two different studies because a healthy dog may not be behaviorally healthy. There might be different effects on behavior and health. What I can tell you is that for male dogs, the downside of not being neutered, the downside risk is quite a bit smaller than in the case of a female dog who is not spayed and who is also not bred. So every time a female dog goes through an estrus cycle, she gains an increase in a certain problem down the road.
So you're thinking more about cancerous problems, right?
Yeah, and so there are accumulating risks for each estrus cycle in which she is not pregnant because pregnancy is protective. And so obviously if a dog is a breeding dog, it's going to be bred and pregnant, and that risk does not get as great. Working dog environment, it's complicated because dogs in estrus obviously might have to fall out of a training, at least a group training environment for a while because they might be such a distraction to other intact male dogs, et cetera, et cetera. And so it is incredibly convenient to spay and to castrate dogs by 6 months of age from a management standpoint is incredibly convenient, and that's what we were taught to recommend. And so that's what we recommended. We recommended that with zero evidence that it had a health benefit to the dogs. For female dogs, it probably does have a health benefit. Whether it has an orthopedic health downside or a behavioral health downside is probably undetermined. And I think it's going to be, if at all, it's going to be years before we really tease that out. And so I still recommend spay and castration for pet dogs. Obviously, they're pet dogs. They're not looking to breed them. I strongly recommend weight management because what a lot of pet dogs don't have is an observant owner in terms of how many calories the dog should eat. The dog comes in excessively, very high body condition. When I look at the dogs that were at your seminar, and I look at the condition of those dogs, I go, almost all my clients would say those dogs are underweight. Skinny, and that they should probably feed that dog more. And I look at those dogs going, they looked so good. They looked so athletic. They looked so healthy. But that's not what I see every day. I see a lot of overconditioned dogs. And so when you hear about the orthopedic downside risk for early spay and castration, I don't think it has been controlled for obesity or at least overconditioning. And so I think if you did this study, I would want it to be done in a working dog population where handlers are highly attuned to what an athletic body condition should be. And if you had spayed athletic Malinois compared to intact athletic Malinois and you followed them over time, you might get an answer to that question. But right now, we don't have a great answer for that question.
Yeah.
Female dogs have higher risk. I think there's more benefit, more upside than downside, but we don't know about behavior. We don't know about all of the subtle athletic changes, increased risk for orthopedic disease by, spay before a year or 16 or
Yeah.
18 months.
Yeah, that's kind of what the bone structure and the density and so on. That's kind of what whatever it was like. I don't know how many years. It's a few years back now. UC Davis did some study with the Goldens and the Shepherds, and again, it's like this is the difficult part, at least in any canine science. It's like we make one study and we have 10 dogs and we come out with a conclusion and it's not replicated. Being in the dog training side or in the veterinary side, like somehow it's very quick to, okay, that's what we found. And even though the study clearly says, well, that's what we found, but use caution because clearly this is a very small sample and so on. But with a little bit of time, it gets blown up and becomes not even legit, but it becomes no, this is what it is. All of a sudden, it's like it becomes so strongly accepted.
Dogma, as it were.
Yeah, yeah, and to the point that nobody even thinks to do another one. That's the interesting part. It's like, I mean, there is quite a few studies on the dog training side of things to where they have big holes in the studies, they have small samples, they're done 30 years ago with some idea what the outcome should be, never been replicated, but nobody ever even considers or just plays with the idea to let's redo this, let's try it again and see what comes up. Not one time.
Yeah, the veterinary profession, as we are trained, we are relatively unchallenging. And so we accept these sorts of publications at face value without challenging them from an evidence standpoint, without challenging them from a statistical power standpoint. We don't look at them and go, well, those were golden retrievers collected at a veterinary teaching hospital. Are those retrievers representative of retrievers generally? And in fact, they aren't, because dogs that present to a veterinary teaching hospital are a different subpopulation of dogs than dogs that I see, or dogs that discount health clinic sees near me at the Humane Society. And so there are different populations, and what we publish in the veterinary literature are convenience samples. We publish what was convenient to collect. We don't go out and we don't do the hard work of saying, okay, let's find out what a representative population of golden retrievers should look like. Even the golden retriever study was dog fancy. It was high end, or at least people who considered themselves in the golden retriever fancy. It was not all of the Amish farmers who are producing huge numbers of golden retrievers. It was not those golden retrievers. So does that study represent the dogs that I see when 2/3 of the purebred dogs that are coming into my practice are coming through Greenfield puppies out of Lancaster County in Pennsylvania? So I don't know. And it's a challenge because we don't have the ability to recruit and do the kinds of statistical studies that they do in human medicine. If you put one of these studies in front of somebody at the New England Journal of Medicine, they would laugh at a study looking at 35 or 85 dogs. They would go, really? 85? That's what you want to publish on? 85 individuals?
And 85 is, in fact, considered an incredibly big number, right? Yeah.
And so I think it's good to remain open-minded, and I am more open-minded now about age of spay, age of neuter, and I get less worried about an owner who comes in and says, well, I might want to wait until she's 2 years of age. I'll say, I don't think that's cruel. I don't think that's dangerous. I wish I had better data, to provide a better opinion for you, but you've made an informed decision to wait, and I think that's fine. My only, very firm, and I feel this because I do the surgery,
Hmm.
is that I can tell you a spay on a 4-month-old German Shepherd is a hell of a lot easier. It's a hell of a lot smaller surgery than a 2-year-old German Shepherd. I promise you, it's a lower complication rate from a surgical standpoint. And when these people who publish say that we should wait until they're 2 years of age, particularly with retrievers who tend to be, they tend to get fat quite easily. And I'm pretty sure the complication rate from the surgery balanced against the rare things they're worried about seeing an increase in. I think the surgical complication rate will cancel out any theoretical benefit by waiting until they're 2 years of age in the average golden retriever, just from a surgical standpoint. Have I done lots of 2-year-old large breed, slightly overweight dogs? I've done tons of them. Touch wood, everything's gone well. I'm happy to do them, and I'm not going to argue with a client and make them feel
Yeah.
terrible if they want to wait that long. For a male dog, I honestly don't think there's any downside at all in waiting until it's 2 years of age. I don't think there's any health risk or any health consequence to waiting until it's a bit older.
Interesting points you're making. Very interesting points. But you're right now. I mean that, like even as a breeder, my just my logic is, and I'm sure it's influence just as you are saying from the trend that we are in right now. It's like if any puppy buyer would be like, we are thinking to neuter, and I'm like, wait, don't, like, why? First of all, what is something that because like I now that I'm thinking, a lot of times owners end up spaying or neutering because the dog is too active or he doesn't walk on leash. Like kind of the reasons are really out there, completely having nothing to do. Like clearly nothing will improve by in the behavior or the training of the dog if it gets spayed or
Yeah, I don't take those parts out.
right.
Whatever the parts are, I don't take them out.
And so I am on the same boat as most of the dog owners, I guess, today, to where it's like, let's wait a little bit, let's have that body develop. And with males, it's a little bit of a toss-up, I guess. And depending who has the dog, like, of course, once testosterone goes into a male body and the dog already has experienced it, and even when we take it away, it's not going to be as effective in like male to male aggression, if that's something that we're concerned about. But if it's done, as you say, at 5 months or whatever early age, where it didn't kick in, it didn't run into the blood, it didn't, I am a male, right? It's the testosterone didn't get there yet. Then we have a different kind of dog. But then it's very, like, I'm sure you can, and it's not difficult to recognize a male that has been neutered and a male that it's not, especially if they're done in an early age. They just develop in a very specific, different way, like most of them. There is something, and I wouldn't say, well, they're more tall and skinny or they're more short and fatter, but there is something that in the overall picture you can see that it something is.
Particularly for the large breed dogs, there's quite a bit of testosterone influence on head shape and obviously muscle gain. Testosterone is a huge influence on athleticism in dogs, just like it does in people. And interestingly, early castration and early spay prolong bone growth. So actually, spaying them or castrating them early results in a slightly larger specimen. There's slightly prolonged long bone growth. But the difference between, castration at 6 months and castration at 16 months is so slight that there's probably more sibling variation within a litter than there is, chemical or testosterone or, whatever influence if you split the litters and spayed half early, spayed half late, castrated half early, castrated half late, there'd probably be more variation within those cohorts than there would be differences between the timing of the procedure. But there are differences. It does influence it, and it might play a role in certain orthopedic injuries. And so I'm open-minded enough to listen to that argument and say, if you've got a high octane potential, working breed dog or competition dog, and you want to wait until it's 24 months of age to neuter it, if at all, I'm okay with that. I don't think that's a humane or a health issue in the negative. I think it's an informed decision, and I don't have a scientific argument to stop you from making that decision at the moment.
It's almost very surprising that we have kind of plateaued and we're not doing more research to that, because it's so, isn't it the most common surgery in vet clinics?
We were in vet school, and in surgery they said spay between 6 and 9 months, and we wrote it down, and if they tested us, we answered that way. And it wasn't until 15 or 20 years ago, when I became re-engaged in the academic interest in shelter medicine, which is very interested in doing pediatric 8-week, 12-week spays and castrations, that I started looking at this from an academic standpoint, and discovered, to my shock, that what they had taught us, while it sounded great, it had no science underneath it. It was just something that somebody had to say in a lecture, and we dutifully parroted it, even though there was no science underneath it. And that again, that's a challenge within the veterinary field, is that we have this blind belief in things that were taught to us that really had no basis in science. And the difficulty is, how do you create the science to answer the question you're asking? Is it better to spay at 9 months or 36 months, or to not spay at all? And I think, from my clinical experience, I think if you're not going to breed the dog, I think spay is healthier at some point. And whether that point is 12 months or 24 months, I'm not sure. I can tell you from a technical standpoint, it's easier for me as a surgeon at 4 or 6 months than it is at 24 months, particularly if you let the dog get fat. It becomes a very much more challenging procedure at 24 months than at 6 months of age. Nevertheless, it can still safely be done at 24 months of age.
Speaking of weight management, what is your best advice to, because sometimes people all of a sudden realize that they really have a super overweight dog, and they wouldn't do that to themselves, but they would decide, okay, you're eating all of a sudden now half a cup, and you're gonna drop the weight within 2 weeks.
I have to tell you, it is the conversation I struggle with the most in clinical practice, is they call it the fat pet conversation, because it goes something like this. I don't want to trivialize it, but here's the conversation, and I have this conversation at least 5 times a week.
Yeah.
Over-conditioned pet in front of me. The owner is engaged. They're not absentee. They're caring, and I tell them for perhaps the 3rd year in a row that their pet is over-conditioned, and they reply with, "But he or she only eats," and then they tell me how little the dog eats, or the cat. And when I reply, "Well, that's still too much," they're shocked that somehow this pet, and they might have even cut the calories, they might have cut the portion, but they're somehow still horrified that this pet, who's acting hungry at home, is still over-conditioned. And I look at them and I say, I'll bet the people on my 600-pound life are hungry all the time. And they have an enabler bringing them food all the time, because you don't get to be 800 pounds bedridden by yourself. You need an enabler.
Yeah.
And you're enabling your pet to become obese by not looking at it objectively. And if you can't tell, bring it by the office. We'll put it on the scale. We'll let reality check on the scale come in. We'll let the front office gals look at the dog and say, yeah, that dog's fat. Dog could eat less. And if you're feeding it twice a day, and the amount that you're giving it is still, you think, ridiculously small, feed it once a day. Dogs can eat every other day. They
Right.
fast beautifully. They are an amazing creature. You could feed them literally every other day, though that would break the hearts of most dog owners to do that. And
This
so I
is
think
me.
for the
Sorry to
99,
interrupt you, but this is this is me and Natalia, my wife. Like sometimes, and I, but I do it very randomly. It just almost it becomes to the point where it's like they can skip a meal today. It's okay. It's been 10 days or something. It's really totally fine, and it's actually there is benefits that they skip a meal. And then we have this little argument. She just cannot not go give at least a little something.
right? No, this is the thing that's going to make me quit veterinary medicine at some point. I'm going to have one more fat pet conversation, and I'm just going to say I'm done. I just can't do this one more time. Because the first argument is, well, I'm already feeding this ridiculously small amount, and then I say, well, you should feed even less, and it just you can see them trying to do the math on, well, how can I not actually do what the doctor's saying? Because the dog's acting hungry all the time. I said, well, of course they are. Unless you have one of these weird northern breed, dogs that can go for days without eating and is incredibly fussy. I've never owned one of those dogs, but I have them as patients as well, where they you feed them and they walk up to the bowl and they're just not going to
Not
eat
right now.
for
Yep.
for half a day. And I think that's weird, but I think those dogs just never have the kinds of problems that we see, particularly with retrievers. We see so many obese retrievers, and we've had them over the years where they're so overconditioned that at a very early time point in their career, they're having all the orthopedic disasters that shorten their career. So they are literally, because of the owner's inability to cut the calories, they're shortening the dog's career because of obesity.
And what would be any specific protocol as far as how much time would you give to like we just got a female, you know 2 years old. She just came back because the people couldn't have her anymore, a Malinois, intact, just like a square, a coffee table, like literally like regular patient of
I don't
yours.
think I've ever seen that in a Malinois.
I know. Yeah. So it took probably, now I would say, I don't know, we are maybe 3 weeks or 4 weeks, and she is looking good. There is a little more to do, but it took us this long, and I don't know if it like pushing it more or taking more time with losing weight, if it
So
even matters.
So I think, well, dogs are beautifully adapted to fasting, so they can go for literally days without their biology or their physiology trying to fall apart. Unlike cats, cats cannot do that. Cats cannot fast for more than a very short period of time without starting to fall apart metabolically. People are remarkably good at fasting as well. So dogs and people can fast for long periods of time, it turns out. So with an owner like yourself who has an eye towards what the dog should look like and lots of experience with other dogs, I think you could take a faster, more aggressive, dieting approach. Most of my pet owners are hardly on board with the idea of calorie restriction to begin with, and so I say, it took them 2 years to get this big. It can take them 2 years to get smaller. We're not in a huge rush unless they've got serious orthopedic compromise where we are under the gun to try to get some weight off of them so they
Yeah.
can start moving better. And so if they're and I have plenty of 3 to 5 year old, they're perfectly healthy. They don't have any orthopedic compromise yet, but they're significantly overconditioned. We'll really try to get those dogs turned around with fewer calories, and I try to, again, I'm not trying to be cheeky about this, but I'll say there are only 3 ways to feed a dog. The same amount, which does not seem to be working. We could feed more, which seems absurd, right? If the dog's overconditioned, feeding the same amount isn't working. Feeding more is absurd. Therefore, the only other remaining option is less, right? And doesn't and they'll tell me, well, how much should I feed? And I'll retort with, well, how much are you feeding? And they'll tell me a bowl full or a handful or two hands full. And I'll say, does anybody in your house bake? Has anybody measured a quantity? Because a handful, a bowlful is not a quantity.
Right.
It's it's a hope or a wish or whatever, but it's not reproducible. You've got to tell me how much you're actually feeding, and if you tell me how much you're feeding, I'll propose an alternative smaller amount, but it's less. It's always going to be less than what you're feeding now.
But the fasting is a very good one too. Like I almost surprised that I didn't think of adding a day of fasting on top of reducing the food and exercise and all that. That's a very good one. And we do, and I want to run by you how that makes sense. Like typically with the females that have puppies and it's time to separate them and wean them off, one thing that we do is we fast for a day or even 2 days, depending what shape the female is, just to kind of break that milk cycle. And I don't know if it does much or no. I don't know if it's something just a mythological thing that I know way back from Eastern Europe, but I do it religiously every single time.
I'll look that up to see if there is anything behind that. But I can tell you that with most nursing mammals, they will consume muscle to keep making milk. They'll burn muscle. They'll convert body condition into milk at the expense of their own health. So that's my seat of the pants answer.
But it's with the time when now the puppies are not there anymore to suck and convince her that she has to produce. You know, it's that break point where the puppies are now old enough.
Gotcha. So she is no longer nursing the puppies,
Exactly.
but she's
Yeah.
being
So it's like
fasted
this
to
2 days.
cut down milk production.
Yeah. Yeah.
I'll look into that. I'll see if there's any repro work on that within my profession. There are a number of repro specialists in the field, and so I'll see if I can find an opinion on that for you.
Yeah, because we breeders, we do things because it's just how it's been done. And some things make sense and some things are like this, a little bit mysterious. Does it really matter or does it, you know? Let's talk about the psychotropic medications. In the last 10 years, I remember it was late 90s, I went to Cornell for a summer camp on like aggression behavior in dogs, and there were quite a few of the now quite famous, and it was just hitting the ground, this whole like there was enormous amount of evidence how successful and how useful and how we can do. Quite frankly, there is dogs that are very quickly put on this kind of medications for no apparent reason. Like to make it really obvious, a young 7-month-old that just active. It's a 7-month-old, whatever the breed you want, just wants to have 5 minutes to run like crazy. And then he's okay. But somewhere, somehow, the dog ends up on regular medication, psychotropic medication. And it's becoming very popular. And I don't know why is it becoming so popular? Is it something that we don't know, that veterinarians that are prescribing know? I guess there is quite a few different reasons, but what do you think of psychotropic medications?
So there are dogs who have global anxiety, dogs who and my threshold is Does your dog need chemical restraint for events like fireworks or thunderstorms? Does your dog lose his mind for very particular, discrete events? Or is your dog losing his mind 15 times a day, every day, for for things that you cannot control or stop? And so that's kind of a threshold for me for psychotropic meds, anti-anxiety medications. We've had the question from young puppy owners, dogs that are perfectly normal, they're just exuberant,
Right.
and whose owners are not really providing a structured or unstructured play environment for the dog to act like a puppy. And so they live in a townhome. We're in a high density, residential area. Maybe they don't have a dog park that they want to drive to, but they're frustrated that this dog is so active. But they got a square-headed terrier puppy, and they're concerned that it's so active. And we've had the conversation saying it's being a puppy. You've got to find some kind of a play outlet for that kind of behavior. Get the dog into a group training environment, a doggy daycare, a puppy class, something where it can blow off some steam with some other dogs, maybe wrestle with another dog 2 or 3 hours a day, and then you pick up the dog and it's a tired dog, because that's a beautiful thing. If you've got a dog who's had a chance to burn off that steam and is now in a better frame of mind. So we've had those conversations where people have had an unrealistic expectation of what a young dog is supposed to be doing. We've had people rehome perfectly healthy, playful puppies because they were too exuberant. We've had them find another home for them.
Which
And
is not a bad thing, right?
if the original owner's expectation is not willing to shift and align itself with the reality of what they got, then I think it is a good thing. Sometimes that dog stays in our practice and we get to see it as it grows up and we go, wow, it's a perfectly normal, healthy, fun dog. And then the original owner goes out and gets a new puppy because, of course, they still are in love with this fantasy of having a dog. And so they go out and get another puppy. And then they have another puppy experience, whether it's the same or a slightly different one. People sometimes think that veterinarians should counsel pet owners in what they should select as their next dog, but that's not the way it happens. What happens is somebody gets a dog, has it for a couple of weeks, and then calls us to set up an appointment for us to meet it for the first time. Nobody calls me in all of my years of doing this. Nobody has consulted me before they got a dog. They always come to us a couple of weeks after they've already acquired, after they've already fallen in love, after the kids have fallen in love with the dog, whether it's a good dog fit for them or a bad dog fit for them. It's coming with 2 weeks of emotional attachment baked into it. And I've had exactly 3 people in 34 years return a dog at my suggestion because the dog was just so reactive and so aggressive and was in a family with young children where I said, let me tell you how I think this is going to end. Somebody you love who's under the age of 5 is going to get bitten on the face by this dog.
Yeah.
Pretty sure it's going to happen. Might not happen today or next week, but it will probably happen within the next 6 months, and then you'll want to rehome the dog. Or you could take it back to the breeder right now. One was a Brazilian Fila, and the dog was growling at me as I stepped in the room at 8 weeks of age. And the breed standard is to not allow a stranger to touch it. And so, it's a tough breed. It's not a dog that I would ever recommend as a family dog for somebody who's got young kids and friends of their young kids that they like. It's not an appropriate pet dog for the average novice dog owner. Maybe in the hands of a highly competent, person who can direct that dog's behaviors, maybe it could work, but not in the typical novice, pet owning hands.
Right. And even if 5 of them do okay, the 6th one, when it does not do okay, it's a major problem. It's a serious problem. Yeah. This is not a joke no more.
I mean, we joke about, the Chihuahua is not going to probably put me in the hospital, but it's still unpleasant working with a really aggressive Chihuahua. But when you're talking about 150, 180 pound or 200 pound plus dog, that dog can clearly kill you.
Yes.
If things go badly.
what is a like a protocol for vaccinations for puppies and then for later on for older dogs? Like I hear, and I'm not sure how valid this is, and I don't even know like where I hear it. Of course, the internet feeds you things, but for example, that there is a conversation going around that we don't need to vaccinate at least the for the DHLPP this kind of vaccination every year once it goes through the early ages through the shots, and then it stays much longer in the body and so on. What is the protocols you follow with
Well, I'm
vaccinations?
I'm happy to report that there's quite a bit of data on this
Nice,
one. So
nice.
I feel confident answering this, and I have a bit of experience and advanced interest in vaccines and immunology and so forth. And there are remarkable, exceptionally good vaccines in the world of veterinary medicine. I mean, they're so good that a single dose of a rabies vaccine at a dog over the age of 12 weeks will likely confer even several years of immunity after the first dose. And that's a remarkable thing that could happen. Now, we routinely boost that at a year of age, and we know that that booster is good for at least 3 years if we use a labeled 3-year product. So vaccines can be given very infrequently for extremely good vaccines like distemper and parvo. They're extremely effective vaccines. The modern vaccine technology is extremely good. Going through the series as a puppy, and for distemper parvo, it is a series until they get out past about 16 weeks of age. We don't know if they're reacting reliably, so we vaccinate them until they hit that milestone at four months of age, and then they're good for a year. The booster at a year.
And let's stay with the puppies, because again,
Go ahead.
like as a breeder, I'm a little selfish here. So do you do, let's say, what, 6 weeks and then you skip a week, or what would be a best practice?
Excellent question. So the interval is recommended to be no less than 2 weeks, but we don't want it to be so long as for whatever protection they gained from the prior immunization. So we don't want that to fade so much that they are at high risk. And so typically we have a staggered protocol. In my office, if I know a breeder, we'll do 6, 8, 12, and 16. So we'll have a 2-week gap between the 6 and the 8, and then we'll have month gaps between the succeeding two. The vaccine for rabies is more regulated, and so you cannot vaccinate under 12 weeks of age. There's no vaccine approved for a less than 12-week-old dog, and all of the vaccine failures for rabies have been in less than 12-week-old individuals. So there's probably some validity to that. And there was a study recently published on post-exposure vaccination of dogs in Texas, where they had, I think, a handful of vaccine failures, and they were all in pets under the age of 12 weeks who had been bitten by a known rabid animal. They were vaccinated because they were bitten by a known rabid animal under the age of 12 weeks. They nevertheless developed rabies, despite the vaccine being given. In pets over the age of 12 weeks, the vaccine was protective in I want to say several hundred exposures. And so we know the vaccine is extremely good at the right age. And so for distemper parvo, it's a series starting at about 6 weeks with a conscientious breeder who wants to get things started in the right way. It's not the number of vaccines, it's the timing of them. If I don't see a dog until it's 12 weeks of age, it's only going to get the 12-week and the 16-week. It doesn't need a third or a fourth. It just needs 12 and 16 weeks. It's the age of immunization that matters, not the number of the vaccines. And that confuses a lot of people, even within the profession. They think that there's a first, second, and third that have to be given. And I even see people taking in adult dogs, and they're vaccinating a dog at a year of age or 2 years or 5 years of age, and they're saying, well, it should get a booster in a month.
Right.
If you're using a good product, there's no reason to have to boost an immunization in an adult dog. If it has an immune system, it responded to your vaccine if you used a good product. If the dog doesn't have an effective immune system, and that does happen quite rarely, where they're called non-responders, you vaccinate them for parvo and they do not mount an immune response to parvovirus. And so they can get parvovirus, the street version of it, because they can't mount an appropriate immune response. But you can't do anything for those dogs. There's no number of vaccines that you can give those non-responders that will make them respond. It's a defect in their immune system, and that's an incredibly rare. That's not a thing that we encounter commonly enough to even think about. But it does happen when they do studies of dogs, when they look at testing vaccines and they look at vaccine titers, they find, when they're looking at thousands of dogs, they find some number of non-responders. We gave it a vaccine, gave it appropriately, gave it at the right age, never mounted immune response to that vaccine.
And as you said, because you can get so many different brands of vaccinations, and you don't know where they're stored, you don't know how well they're taken care of, and then you're thinking you're doing the right thing, and probably there is no point of even giving the shot because it's told or whatever happens to a vaccine that it wasn't stored properly, or it wasn't transported properly, and so on, right? And that's
so for distemper parvo combination vaccines, the best vaccines are called modified live. So it's an organism for the disease that has been grown in culture for enough generations that it has lost its ability to make you sick or to make your dog sick. Yet it's still a real virus. And so by injecting they call them attenuated viruses. So the vaccine is real, it's live, but it just can't cause the disease of distemper. It can't cause the disease of parvo. But what it does when it gets into the young dog is it multiplies. And so you give a small amount of a real virus, it multiplies, and the dog mounts a very large immune response to a real virus that protects it against the street virus, which can cause disease.
right.
And so modified live vaccines are much more effective at stimulating immunity than killed viruses. Rabies is uniformly a killed virus,
Right.
because it's such a dangerous disease. It's uniformly fatal in both dogs and people. And so there's no longer any modified live viruses for rabies on the market. And so killed vaccines often require something else to make them more effective. In the case of rabies, they do adjuvants. They make them more stimulating to the body by adding extra things to make the body notice that you've injected them into the dog. And it's adjuvants that may be more likely to cause reactions than the actual rabies protein that's in the vaccine. So it may be the adjuvants that make dogs react in a bad way, if they get a swollen face or whatever.
Yeah.
Though I can tell you that those things are quite rare with today's vaccines. The vaccines that we use today are remarkably good across the board.
What about the lepto? I know some Malinois tend to have a reaction, but at the same time, if every time that we haven't had a dog that had a lepto, and when we decided that it has to do it, it seems like there was always a booster, like one, and then whatever, like within a month or weeks or something, and then they had to do another one. Is that still a legit way to do it, or can we skip that booster with the lepto as well?
Unfortunately, for the good vaccines, rabies, distemper, parvo, they're really awesome, and you can probably get a single vaccine in a 16-week-old puppy or older and get a great response. But with Bactrians, with things like lepto, Lyme, Bordetella, although the nasal Bordetella is live and you get a great response from a single dose of that one. But for lepto and Lyme, you need a priming dose and a booster dose, 3 to 4 weeks later. For flu, it's unclear. The flu vaccine is a killed vaccine, but it's unclear how good the vaccine is over time. And so the recommendation still is a priming dose, a booster, and then yearly boosters after that for flu, the two strains of flu that are out there. And so that's our recommendation in the office. I can tell you the lepto recommendations changed. There was an internal medicine group came out with a consensus document in November of 2023, and they shifted the recommendation from a risk-based recommendation, that is, the owner and the vet decide whether the dog is at risk for lepto or not. The recommendation changed to all dogs over 12 weeks should be vaccinated for lepto, period. And the reason is we're terrible at estimating risk. We're terrible. You might as well toss a coin. We're just very bad at estimating risk. Dogs who we think are at low risk can get it. Dogs who we think they're at high risk may not get it. Right. The vaccines are so much better now than they were 20 years ago, both in terms of reactivity, fewer side effects, fewer bad reactions, and they're so much better at protection against disease that they're now across the board saying every dog over 12 weeks should get lepto. Certainly in a temperate climate like Florida, every dog should get lepto.
Yeah, for sure. Interesting. What about, did you hear about the recent travel regulations that they're coming with there is a,
yes,
like the puppy up to 6 months old or something?
It's probably two more podcasts, Ivan, because it's incredibly stringent from the CDC.
Yes.
Center for Disease Control, and it's probably a reaction to rabies. A number of rabid dogs have been imported over the last several years from high-risk countries. They've come in likely with fraudulent vaccine histories. So people faked vaccine certs. It might have faked health certs, for that matter. Got them here. Dogs developed rabies, obviously exposed, adoptive or foster homes to rabies. And it's a big deal. Rabies is a uniformly fatal virus in all species. It's not.
So you think they're not overreacting?
So I think it's a real problem, but they've made some fairly significant changes that will affect lots of dog breeders, people who show and work dogs across, particularly the Canadian border, are going to be impacted by this in a big way. And they've absolutely said no puppies can come in unless they're old enough to get a rabies vaccine.
Yeah, I think it's 6 months old or something like that.
So it's significant changes. It just got announced. It was announced before anybody within APHIS or USDA really had a chance to weigh in on it. So the people who actually issue these certificates for travel were not consulted before the conditions were announced. So it's a very fluid, emerging situation. But there's a ton of people in Canadian, U.S. border towns whose veterinarian is in Canada. They live in the U.S., but their vet's in Canada. And they routinely go to Canada to see their veterinarian. And so, it will be interesting to see how it ends up being either modified or adapted, because Canada that was not the target. The Canadian, influx of dogs was not the target. It was dogs coming from extremely high-risk environments where rabies is abundant and vaccines are rare. And that's a handful of countries. But they made it a blanket approach instead of tailoring it to the risk. What they should have done is said, okay, if you're coming from Iran or if you're coming from Afghanistan, those are high-risk areas, very little deployment of vaccine in the native dog populations, high-risk dogs, a lot of interest in people in the U.S. importing, bringing these dogs to rescue them. So we get the emotional connection, but you're literally taking dogs from a high-risk population, and then you're handing them into a foster community who may not have any idea what they're taking on.
So it's not, so there is still might be some adjustments to it to be made. It's not
because I can tell you that the USDA and APHIS and the people who actually countersigned the certificates for import were not involved in the discussion, and they found out about it when it was announced.
Yeah.
And so I think there's going to be some back and forth, and it may well be modified, and particularly for Canada. I don't think Canada is a giant risk to the U.S. We have rabies. Canada has rabies. Mexico has rabies. Mexico has a larger unowned dog population, you might legitimately argue maybe we tighten up the regs or the import export with the Mexican border. I don't think Canada's our problem.
Yeah, hopefully, because that's a. I mean, there's gonna be ways. There is always some ways, but it's surprising how this kind of legislations they just come out of nowhere and without any discussion, without it's just like, okay, this is what's gonna happen.
So another thing that was happening was dogs from extremely high risk were already flagged. And so if health certificates were originating from Iran, that was getting a lot more attention. And so there were rescue groups who were deliberately sending
Right.
dogs to lower risk countries to get the certs written in a lower risk country so that it wasn't getting the attention. So, sometimes we are our own worst enemy when, I get that the dog is the focus, but rabies is not a trivial issue. You can't import rabid dogs, drop them into a foster environment, and particularly if that dog gets adopted and goes into the general, ill-informed, underinformed, not expecting to have a rabid puppy community, that can be an absolute disaster.
Yeah. No, I can see the point. I guess it's unfortunate, but I can see the point. What is your favorite? We just last question. I'm just curious of in your whole practice, do you have something that it's kind of like a very pleasurable like part of the job that you when you have a dog or a cat or that you need to do something, there is something that you really like, enjoy more than the rest?
There's something extremely satisfying about surgery when you've got a surgical problem and you do something positive for the dog by, there's nothing more medical than surgery, right? I mean, you're taking control of the patient's respiratory system, its cardiac system. You're cutting something out, you're putting it back together, you're repairing a wound. And then particularly if you've solved its problem, if you've taken off a dangerous thing or you've solved a problem that way, it's hard not to feel good about
life,
that kind
right?
of intervention.
Right.
That doesn't happen as often as I would like it to. Sometimes you're taking stuff off and finding out that it's not 100% curative. Sometimes you're looking at a problem surgically and you're going, this is a tough one. We may not have an intervention here, but that's probably the highest level of, we directly did something that benefited that patient. But honestly, if a client comes in with their 20-pound overweight golden retriever at 3 years of age and they come back a year later and she's back on condition, I think that's a pretty big win. If
Right.
an owner listened to us and got the dog back in shape, I always give huge credit to owners for getting an overconditioned dog back in shape because I know what the dog's doing when it goes on the diet. I know it's bugging every single human in that household for food the whole time it's dieting. And so I understand the big brown eyes and the fact that they're, well, the dog's acting hungry. She must need more food. It's like, or not. If she's, if she's at a healthy body weight, maybe she could skip a meal.
Right. The difficult question, of course, the opposite of it. How do you deal with euthanasia? Like I know when I worked at the SPCA in San Francisco, and it was a no kill, which is another conversation that I don't want to go too far, but the no-kill situation was that we have to decide at the door, is that dog coming in or is it not? So if we say that it's not, that means basically I'm saying that dog has to be put down. It just, it's a sketchy scam in a way that it's just incorrect to get donations and claim something that actually it's not
Well,
like that.
Well, it's we didn't kill it. It's not no kill. It's we didn't kill it.
Yes. But so I had a very difficult time, and somehow I worked 5 years there, and I cannot say that I got used to it, but once I left, like that was probably the most interesting feeling that I was like, I do not need to make this decision no more. And I mean,
So
that was just,
it is the decision to euthanize.
to me, yes.
The hardest.
Yes.
That's the hard part. From a care provider, people are coming in with a sick pet, typically, who's got a problem, and maybe the diagnostic process is not within their budget.
Right.
So they've got a very sick pet, and they can't do the thing that would tell us whether it's fixable or not. And that's a reality of my profession, is that we have diagnostics, or we could send them for diagnostics, but perhaps they can't afford the diagnostics.
Correct.
Or I can look at a pet and I can see it's incredibly rough condition, and I can share with them that, I've seen 100 cats that came in looking just like this cat, and I have not seen a single one of them do well. And I don't know what your cat has. He could have one of 6 or 7 different things, but he's got something bad. And I doubt we can turn that around. And I think the kindest thing you can think about is not making him look worse than he looks right now, because he will only ever look worse. And at some point, you'll decide it's too late, or we waited too long. And it's sad to have to make the decision, but it's even sadder to wait too long to make the decision, because now your pet has had more anguish, more suffering until you came to grips with it. So as the care provider, I'm kind of off to the side, trying to give perspective and trying to give them a framework that says, if I had 100 cats who came in with this and 50 of them left okay, I'd say pull out the diagnostic cork. Let's do what we can. Let's get revved up to find out what the problem is. But when I see it looking so bad that I've never seen one turn around from that condition, I should share that with an owner.
Yeah.
And is it wrong for them to head up to the multi-specialty, hospital and maybe pull out all the stops and have a hurry up abdominal ultrasound and get a bunch of diagnostics underway and then find out what it is? It's not wrong to do that, but they should have at least the benefit of my experience saying, I haven't seen it turn around. You ought to know that going into this. And it's not wrong to say, this is a kind decision.
Right. No, it's
Even
a
though
beautiful, sometimes it's really a beautiful decision. And I wish that even in all countries in the world, this is an option for humans.
A whole nother level of complication with decision making. But from a medical perspective, there are very few diseases that kill you humanely. Most of them kill you horribly.
Right.
And if you could choose a time to die before you're absolutely horrible, that would be better.
Right. Right.
And I think one of the difficulties is we are often trained to not share that experience, and we are taught to say, well, it's not my pet, it's not my decision. It's your decision. And yet we don't share the framework. And my framework is I've seen 1,000 pets like this. I've seen 1,000 of them. Have I seen one get better? If I did, I would share that, and I would say it's 1 in 1,000. But if I've seen none in 1,000, I should share that. I should say, I haven't seen one turn around. And you should know that. If you want to pursue it, I don't think you're cruel, but you're going to need to, get over and get those diagnostics going, because your pet is suffering right now, and you can't dither with this decision.
So as a dog trainer, we also have this problem, and I wasn't even thinking of this, but now it just popped into my brain because of some serious aggression or whatever behavioral problems, and as a trainer, hopefully as a trainer you do have the knowledge to make this kind of advice, because they should not be taken lightly one way or the other. But right now I'm sure you are familiar with the whole problem between the forcefree and the other trainers that do use some kind of versive and some kind of, okay, I will tell you no, and if you don't listen, I will give you a little pop and I'll make you listen, because there are some rules that we need to all follow. And then you have the force-free community that are really losing their mind to where there is like mission statements that go against any laws on planet Earth. To the like everything that is aversive is it's so bad, and the dog can never fear anything, and then you end up with a dog that you can say, well, we tried everything, and we went to the best trainers, we went to the best animal behaviorists, it was on medication and everything, but we never really told him, no, don't do that, stop biting on like, just don't do it. And then you say, well, we've done enough, we have exhausted all resources, so therefore we should euthanize it. When you clearly, you didn't exhaust, you did not want to go into a place where your ideology, your understanding of what is okay and not okay didn't allow you to do. You don't have that in veterinary practices, but in dog training, it is a serious problem, because it really, in a lot of ways, the force-free community and the people that train dogs the way I would, this is one of the hardest topics, to where they can say, well, we tried and we know that it's not going to work. And well, you have not tried a very important thing, just to tell that dog, don't do it. And if that was enough, to show some consequence and see if that will work, because in most cases that works. I don't know where I was going with that, but it's just it's a little different twist, I guess, we have in dog training, that as a veterinary doctor, you don't have that.
Well, thankfully, we have less of that, but we still have behavior issues leading to euthanasia decisions, and they're probably not probably they are absolutely the most heartbreaking decisions, because these are often extremely healthy dogs. They're often, when they're good, they're often the best dog this person has ever been with, in terms of intelligence, in terms of in some ways trainability. And your point about the no corrections school is, how do you stop a dog from jumping up without a correction? If I stand on a leash in an exam room for about 4 minutes, most young dogs will stop jumping up during the course of that exam, and the owners are amazed. It's like, all I did was stand on the leash. I didn't say anything. I didn't do anything. I wasn't mad. I just stood on the leash, and every time the dog jumped up at me, he corrected himself at exactly the right time, exactly the right place
Right.
and humanely on the back of his neck, where he's got 4 inches of dog meat. There's nothing damaged by him jumping up and correcting himself. And I show owners that trick all the time, how to keep your dog from jumping up on somebody. But it means you've got to have a leash handy. You've got to put the dog on the leash. You've got to put your foot on the leash, and you've got to do it consistently so the dog learns. And I'll show them this, and I will literally take them out to the reception area. They'll stand in my hallway, and the dog will start lunging up and down the hallway, and the owner won't think to drop their foot on the leash. And I'll come back out sometimes, and I'll say, put your foot on the leash. And this won't happen. The dog won't be dragging you down the hallway by your shoulder if you drop your foot on the leash. And it's a correction, it's punishment, but it's perfectly appropriate for the dog.
It's
I think the training behavior side of this is really tough, because people get the dogs typically are biting humans, and that's why they're involved with this to begin with. That's why they're seeking a trainer. And these dogs can be super great when they're on, but in certain circumstances, the owners don't have the right tools to safely control and contain them.
correct.
And they don't know what to do. And if they're told, well, you should never punish, you should never use corrections, and if that works at all, it seems to work over a much slower time horizon than corrections.
Yeah, and even if it works, in some cases may not, and then not trying an alternative, it doesn't make sense to me.
Well, I followed your a couple of your posts on that extremely reactive dog that you worked with,
Mm,
where you were rejected by all the behaviorists because you used corrective techniques.
yeah,
But you said to them up front, you said, "I will do whatever you tell me to do. What I will do whatever you say," and nobody would take you on as a client um, because they had decided that you were cruel or you were inappropriate, and instead they were willing to abandon treating a patient
right.
um, without trying to work with you. And I found that startling,
And
but
that's a true story, unfortunately. It's a
oh,
true
I
story.
know, and I'm not entirely surprised because the emotional reactivity against correction in dog training is, and I understand why it's so easy to overcorrect. I understand, particularly with e-collars, how easy it is to push the button when you're
Yeah,
frustrated as a trainer. And the difference between somebody who is a good trainer and who's a terrible trainer is the level of frustration. Because somebody who's good understands it's not the dog's fault. It's
yeah,
a timing issue. It's a command issue. It's a clarity issue. Let's fix that. Let's work on that. Let's not be mad while we're training. But you know that people get frustrated and they become terrible trainers.
yeah, very true. We just cannot be throwing the baby with the water. That's the you know. But who knows? We'll see where that goes. We it's interesting stuff. But I learned quite a few things talking to you, and we have to do it again. I have some other questions. Just don't want to keep it too long, but
Nope, happy to do it, Ivan.
this was really good. All the stuff about the neuter, the vaccinations, the like really everything that we talked. So very cool. And give me the name again of the. How did you say it? The fear-free. The other one was
Low stress handling
low
techniques.
stress handling techniques. Yeah,
Low stress handling techniques.
yeah. I don't know the fear-free.
I think it's more honest, right?
Yeah,
Because
yeah. So
we can't
it's
make
just
it zero
like
stress,
yes,
but we can make it less stressful.
right.
And really, as you said, when you go into a hospital and you might have some, thing done or news given to you that's unpleasant, it's not zero stress. It's how can we
Yes,
make this as pleasant as it can be? And I think that's a more honest way of approaching it.
beautiful. Michael, thank you.
You're very welcome, Ivan. Thanks for the invite.
Have fun in Mexico,
I will do my best.
and
Thank you.
I'll be watching some pictures.
Very good. I'll send some.
Cool.
Have a good night, Ivan.
Take care.